Oh, I think from a satisfaction standpoint, patients are rather smitten with the process. I think they're really impressed or really reassured that they have somebody that, regardless of what their question is, they know who they can call. And if our nurse navigator doesn't have that specific answer, she's still going to be the resource to be able to find the answer for patients. I think family members also are as equally satisfied with having our nurse navigators be a part of their loved one's care as well. They're also able to tap into our navigator as a resource. So I think it's just a matter of, or an element of being reassurance for patients and families.
I think that the amount that nurse navigation improves patient satisfaction is just immeasurable. They feel valued. They feel they're not used to that treatment. They're not used to somebody calling them just to say, how are you doing? How is physical therapy? We haven't heard from you in a few months. Are you still doing well? I get that response over and over and over again, just how pleased they are to talk to me.
Probably one of the best examples of how Priority Consult has really helped our patients is that the primary cares didn't know what to do before when they had a patient in severe pain or symptoms. So they either call me or they'll refer the patient to us with an expedited request. As soon as we see that, we call that patient right away. So I had a gentleman that I got the expedited request, called and did the intake, identified the red flags that were going on with the patient. So went into one of our neurosurgeons' queue, and he did that review within probably 15 minutes. The patient was called back, had an appointment the next day with him, and then surgery 2 days later. So it's just, and before that, patient would have had to go to the emergency department in order to be seen and have surgery that quickly.
We had a patient just 2 weeks ago. We got the referral in the morning. The referral plus a phone call from the physician saying he's had an MRI, he's in a lot of pain, what can we do? We called him immediately. He was on his way home from the doctor's office, got the referral, immediately sent it to our physician with an email saying, hey, can you review this right away? She reviewed it within 10 minutes. We had the patient in the same day. For a steroid injection, not just an evaluation. So he didn't have that wasted appointment of coming in and being evaluated and then having us say, okay, now come back in 2 weeks and we'll do an injection. So I think that process, it was extra quick turnaround that day, but it was the process working as perfectly as it possibly can.